Right. Today we have Dr. D.B. Chakraborty, who is a renowned MD diabetologist and cardiologist from Apollo Hospital, Kolkata. As sir, you know, hypertension is very prevalent in India, and it's a leading cause of mortality and morbidity. Sir, would like to ask you one question on patients' benefit with hypertension. According to you, what is vascular hypertension? How can you investigate it, and what is the effective treatment modalities?
Yes, the renovascular hypertension is one of the important subsets of hypertension. We found in 1 to 5, the tune of 1 to 5% of the total populations if we survey. In a clinical practice, it is very rare, but we do often miss this important subsets of hypertension often. By actually the good clinical examination, well by clinicians and ourselves, it definitely feels one of the clue for development diagnosis of renal vascular hypertension. So, first give emphasis of the clinician for the proper clinical assessment, then we should subject for investigations, particularly some investigations is about blood investigations, routine investigation, urea, creatinine like that, routine investigations. There is some special investigations, as for example, ultrasound, graphy, then CT scan, the renal angio, the renal angio CT scan with CT scan of the renal artery with IV contrast, then MRI scan with sometimes with GAT enhancement, and of course, the most important is intra-arterial aortogram or intra-arterial angiography, which is the intra-arterial angiography is the gold standard. And although we have sufficient data to show that even if it is diagnosed by simple ultrasound, bedside ultrasound with proper renal flow studies. And of course, other subsets of investigations are there, but this is the particularly investigation we have included to the diagnosis of this renovascular hypertension.
Then how do you manage the patients with renovascular hypertension?
Yes, this is a very good question. Management of the renovascular hypertension lies particularly one of the cause of renovascular hypertension. As for example, the commonest cause of renovascular hypertension is atherosclerotic, which are found in the female individual, particularly more than 65. So, if we find age of more than 65, elderly female patients, so definitely, so events of other atherosclerotic infestations other than the kidney, heart, etc. So, definitely one of the clue for diagnosis of renovascular hypertension, we treat them rigorously, the risk factor management. The first is risk factor management. This management of hypertension, management of diabetes, and avoidance of smokers. So, these are the risk factors. Avoidance is the first and primary piece of the treatment of this renovascular hypertension. Then comes the important drugs which are available, good drugs, just like all important drugs are available in our hands. We will try for drugs at the optimum dose. Then if this fails, the drugs fails, then definitely we have got nothing to do other than the intervention. We have shunt depression interventions and surgeon. So, proper interventions in the form of renal artery angioplasty or renal artery grafting. So, this is as we actually done this proper management in a short of renovascular hypertension.
Thank you, sir. Thank you for your valuable time and the knowledge being shared. Thank you.
Thank you.